Professor Sharon Lewin is a leading infectious diseases expert with the Doherty Institute in Melbourne. I spoke with her a short time ago. Professor Lewin, thank you for your time. The federal government has said consistently through this pandemic that it is listening to the medical advice. Now it's telling younger Australians if they want to go against that medical advice and ask their doctor for AstraZeneca, they should. Is that a solid message in your opinion?
This isn't against medical advice. The AstraZeneca vaccine is actually registered by the Therapeutic Goods Administration for administration to any adult over the age of 18. I think what the announcement last night does is it gives people some choice, because there are young people that can understand the risks, can understand the benefit, and will then make their own decisions. So I think giving people more choice is a good thing.
Okay. Given that the ATAGI advice about AstraZeneca being recommended for over 60s, can any GP actually say to a young patient they can safely have AstraZeneca?
Yeah, absolutely. We know that the risk from AstraZeneca of a blood clot is actually really small, but it's about 1 in 30,000 for people under 50 and 1 in 100,000 for people over 60. We know that if you get diagnosed early with those clots and get the appropriate treatment, the outcome is much better as well. So I think it would be absolutely reasonable for a GP to sit down to go through that with people, even people under the age of 40.
Okay, let me ask you this. How does indemnity work? The federal government is saying that it will indemnify doctors against patients' adverse reactions to vaccinations. How does that work? Does it mean that if a patient has an adverse reaction that they can't sue their doctor, or that if they do sue their doctor, the federal government will pay the costs?
Look, this has only just been announced. My understanding is that should an adverse event happen and the person decides to sue their doctor, the federal government would cover the costs. That's what my understanding is of the announcement yesterday.
2/3 of aged care workers are not vaccinated, and they will now need to be vaccinated. The industry says there's some vaccine hesitancy in that group. Should they be offered their choice of vaccine if, in fact, their only choice right now is AstraZeneca, just to make sure that they're all jabbed?
You know, that's an interesting question. At the moment, we're now going to mandate vaccination for aged care. So I think if we're going to mandate something, we should make it really easy for people to get vaccinated, and ideally that would mean giving some choice here. Anything that we can do to make it really easy is the way to go. So maybe a choice is a pretty good thought there, but I haven't heard that that's going to be available as yet.
Is there an argument that, quarantine workers, aged care workers, all of these essential sort of frontline workers should be vaccinated with Pfizer anyway, because you don't have to wait months between jabs before you're fully protected?
Again, that's a good point, but not necessarily. AstraZeneca does give you protection after the first vaccine, actually after the first vaccine of both Pfizer and AstraZeneca. The Delta variant, for example, you get 30% lower risk of infection and much improved protection after the second vaccine. So in any situation where you want a vaccine quickly, yes, a 3-week gap is much more favourable. Anyone with comorbidities, phase 1A and 1B, we've just got to get those done quickly.
Australia's vaccine rollout has been too slow. I think everyone thinks that. But we have had only 2 people in ICU during this outbreak. We have not had any deaths. Infections are being measured in the dozens, not in the hundreds. Does that suggest that the vaccines that we have rolled out are having an impact?
Vaccines that we've rolled out absolutely will have an impact on every individual that's been vaccinated. We know that from large clinical trials. We know that from real-world experience in the UK, Israel, US, people that get vaccinated have a reduction in risk of going to hospital or death by over 95%.
Right.
They have a reduction in getting infected, and they have a reduction in transmitting the virus. So anyone that's vaccinated will get some personal benefit. Have we vaccinated enough people to get a real community benefit? We're not at that level yet.
There's also been a measure of vaccination among aged care residents, and clearly they've been our most vulnerable population since the start of this pandemic. Is that why we are not seeing our hospitals full, our ICUs full, and people on ventilators at this point in this outbreak?
Yeah, look, our numbers are too small at the moment to see what sort of effect vaccination has on hospitalisation and deaths. When we look at countries that have a lot more COVID, vaccination makes a huge difference. If you look at just in the US, over just the month of May, hundreds of thousands of hospitalisations with COVID, about 18,000 deaths, and less than 0.1% of those people are vaccinated. So all of that hospitalisation and deaths are essentially happening in unvaccinated people.
We've seen anecdotally with this West Hoxton party in Sydney that the people who are vaccinated didn't get the virus. So is there any research being done now into what effect the vaccine is having on infections and transmissibility?
Absolutely, and we actually know the answers to those questions. Vaccination dramatically reduces infection. With the Delta variant, vaccination with the AstraZeneca vaccine after the second dose will reduce the chance of infection, any infection, by 60%, and with the Pfizer vaccine will reduce it by 89%. And both vaccines will reduce the risk of transmission by 50%. So we know that vaccines definitely reduce infection. They definitely reduce transmission. They just don't eliminate infection and transmission. So I think that the data that you just said from that party is just a fantastic advertisement for how vaccines work. You know, they really do protect you against infection, against transmission, and against getting hospitalisation and death.
Okay. Thank you for your time.
Pleasure. Thanks very much.
Professor Sharon Lewin. After the break, the holiday cancellation trap catching out families. Welcome back. The latest COVID outbreak has ruined holiday plans for families. In another blow, a trap in cancellation policies is leaving thousands out of pocket.
We are out of pocket over $3,000 now.
How can it be okay for you to take my money and not offer me a service?
Unfortunately, it's a classic case of buyer beware.
In the essence of holiday here this year, I decided to get another family together and we got this gorgeous Airbnb home.
But now most of Australia is in lockdown and the school holidays will be spent at home. Professional organiser Anita Burgess says Airbnb needs to clean up its act.
I contacted the host directly and I said to her, look, you know, you can see there's restrictions. And she said to me, oh, well, why should I take the loss?
Anita says she requested a credit to be used at a later date, but the host was only willing to offer the family a midweek escape after the school holidays.
We saved up this money. We put a lot of thought into this, of how we can do something for the kids during these holidays, and we simply cannot have it just thrown down the drain.
Catherine planned to take her family to the Hunter Valley in New South Wales. 3 days after making her booking, she says she contacted her host with concerns a lockdown was looming.
She came back to me and said, oh, you know, you haven't booked a refundable option. So basically there are no options for you.
Catherine says she's happy to move her holiday to a later date.
I couldn't actually believe that, you know, particularly booking with someone as reputable as Airbnb would mean that I was at the mercy of the individual host.
Border closures are no longer included in Airbnb's extenuating circumstances policy. According to Airbnb, the policy is in place to protect hosts and guests from unforeseen circumstances. Airbnb says COVID-19 and its consequences are no longer unforeseen or unexpected.
The thing about Airbnb is it offers 3 tiers of cancellation policy, and it's the owners who get to choose which cancellation policy applies to their apartment.
Travel writer Uta Juncker.
If you're lucky, you've got one who will give you a full refund up to 24 hours beforehand. If you're really unlucky, you've chosen the one that in some cases only gives you 48 hours after making the booking to change your mind and get a full refund.
Others give you until 5 days before check-in.
If we start expecting Airbnb to do some kind of insurance, to give people some kind of compensation, well, that's going to increase the amount that you pay per night.
In a statement to A Current Affair, Airbnb's head of public policy, Derek Nolan, said, Almost 2/3 of active listings offer a moderate or flexible cancellation policy.
So I got a nice big house, 5-bedroom house, big enough for the family, and yeah, then COVID hit.
Craig lives in Victoria. The state was recently locked down and locked out of WA.
It was just under $2,000, and plus the airfares on top of that.
Craig's host agreed to return half the money. Prior to the 14th of March 2020, guests who cancelled their Airbnbs were offered refund or credit options. On the 11th of March last year, the World Health Organization declared coronavirus a global pandemic. 3 days later, Airbnb changed its policies.
So Airbnb's done a shifty and put a new COVID term and condition in to cover them.
In one of dozens of emails to A Current Affair, this parent claims to have spent $7,000 on an Airbnb in Thredbo, but has only been offered a $149 service fee refund.
In this current climate, something has to be done about this.